Okay, we're going to be looking at osteology. This will be a quick overview of everything that we've covered already. So let's take a look at the anterior. Let me get my pen color here. We put blue. So remember, here is the manubrium of the sternum. Here's the jugular notch. Right here, that joint is the sternoclavicular joint. Here's the clavicle. And then here is the junction between the clavicle and the acromion process. So we call it the AC joint, the acromioclavicular joint. There is a sternal end, and then there is an acromial end. And that's because there is the sternal end here, attaching to the sternum. We just call it the manubrium. And then there is an acromial end that attaches to the acromion process. When we look at the scapula, we said that there was a superior border, a medial border, a lateral border. The other name for medial border was the vertebral border, and the other name for the lateral border was the axillary border. Then we had three angles. We have the superior angle, we have the inferior angle, and then we have the lateral angle. So let's just put here lateral angle, which is right there, which is part of the glenoid cavity. So here is the coracoid process, which is a projection anteriorly. The coracoid process, we said, is an attachment site for the pec minor. It's an attachment site for the coracobrachialis, and it's an attachment site for the short head of the biceps brachii. Short head of the biceps brachii. They all attach to the coracoid process. Here is the glenoid fossa or glenoid cavity. Now we're looking at the posterior view. And we said, we know we're looking at the posterior once we see this. This is the spine of the scapula. That's the spine of the scapula or scapular spine. When we follow it from the medial border and we follow it upward, it goes superior and lateral and takes us to the acromion process, which is the highest point of the shoulder. And even from the posterior, we can see the superior border, the medial border, the lateral border. We could see the superior angle and the inferior angle. Once we find the scapular spine or spine of the scapula, there's this depression above it, and then there is this big depression below it. And that's where we have the supra, meaning above, and infra, meaning below, the supraspinous fossa and infraspinous fossa. And on the anterior side, this large fossa here is the subscapular fossa. And the rotator cuff muscles, remember, are called sits, S-I-T-S. We have the supraspinatus. We have the infraspinatus. We have the teres minor. And then we have the subscapularis. The subscapularis. So we call it sits, the sits muscles. And the supraspinatus, the infraspinatus, and the teres minor, these three are going to insert on the greater tubercle of the humerus, whereas the subscapularis inserts on the lesser tubercle of the humerus. And the origins, the supraspinatus originates here on the supraspinous fossa. The infraspinatus originates here on the infraspinous fossa. And the subscapularis originates here on the subscapular fossa. The only one that doesn't attach to a fossa is the teres minor. The teres minor actually originates right there on the lateral border. Okay. Let's look at the humerus. Here's the head right there, the head of the humerus right there. Here is that groove, right? Kind of looks like a little valley, kind of going this way. That's called the intertubercular groove because it's between the greater tubercle and the lesser tubercle. And the other name for that bicipital, for the intertubercular groove is the bicipital groove. The bicipital groove. And that's because it's where the long head of the biceps brachii travels through. The long head, right? Biceps, bi means two. There's a long head and a short head. It's the long head that travels through that bicipital groove. And sometimes when people have shoulder injuries and they rotate their arm back and forth, they hear a little clunking that takes place. That clunking can be the clunking of the long head of the biceps tendon, clunking in and out of that groove over these tubercles. So it's like bump, 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 bump every time this rotates back and forth. And then midway is the deltoid tuberosity, which is where the deltoid muscle attaches. When we go to the distal end of the anterior surface, these are the two fossas. Here's one, here's the other. There's two fossas on the anterior, one fossa on the posterior. The medial tubercle is larger than this lateral tubercle. And the medial epicondyle is where the wrist flexors, originate. And the lateral epicondyle is where the wrist extensors originate. The wrist extensors. Then all the way at the distal end, we have the capitulum, and then we have this trochlear. Looks like that. Okay. On the posterior side, there's only one fossa. That's the Olecranon Fossa. And again, we have that large medial epicondyle and not as prominent lateral epicondyle. Let's go back to the anterior forearm. This fossa here is the radial fossa. And then this fossa here is the coronoid fossa. Coronoid fossa. And that's when the elbow flexes. When the elbow flexes, the head of the radius fits right into the radial fossa, and the coronoid process of the ulna fits in the coronoid fossa in flexion. Whereas the olecranon process fits in the olecranon fossa in extension. Let's take a look at the forearm. So here is the head of the radius. And here's the radial notch. Remember, the radial notch is here, which is embedded in the ulna. Here is the trochlear notch. Remember, the trochlear notch is going to fit perfectly here with the trochlear. Here's the shaft of the ulna. Here's the shaft of the radius. This is the head of the radius, whereas the head of the ulna is distal. Let's look at the proximal ulna. So this is the ulna. We're looking at it from the side or the lateral view. So here in the front, that's the coronoid process. In the back, here is the olecranon process. Here in the front, that's the trochlear notch. And then here, that is the radial notch. What is the radial notch for? That's going to receive the radial head, right? And it's nice and concave so that it can really articulate very nicely with the head of the radius to allow for supination and pronation. Here is the olecranon process. This is now the posterior forearm. This is the shaft of the ulna. Here's the head of the radius, shaft of the radius, radial styloid. Here's the ulnar styloid. Here's the head of the ulna, whereas here's the head of the radius, or we would call it the radial head. And here's the ulnar head. So here's the radial head. Just below it is the radial neck. This little bump is the radial tuberosity, which is the attachment site for the biceps brachii. It's the attachment site. All the way at the distal end is the radial styloid. Right here is the radial styloid, and that is the ulnar styloid. From the posterior, there's the radial head, there's the radial neck, radial tuberosity, ulnar notch. Remember, the ulnar notch is on the radius, whereas the radial notch is on the ulna. And then here's the radial styloid. The radial styloid is the insertion site for the brachioradialis. Brachioradialis. Let's look at the wrist and the hand. Let's look at it. This is the posterior view, but we have to look at it from anatomical position because this is the way that we teach it, from the anterior. You have to start here first, and then you can kind of figure it out on the posterior. So just remember the thumb radiates out. So here's the thumb, and it's on the radial side. The thumb radiates out. So the thumb and the radius are on the same side, which is lateral. And we learn it from lateral to medial. Then we have the proximal row first, and then we have the distal row. And there's that little silly mnemonic. Some lovers try positions that they can't handle. Okay, so it's the scaphoid, the lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Okay, learn them from lateral to medial, proximal row first, and then the distal row afterwards. Then we have the 5 metacarpals. Metacarpal 1, 2, 3, 4, and metacarpal 5. Then we have a proximal, a middle, and distal phalange or phalanx. If I asked you what is number 1 right here, and you wanted full credit, you would say 5th, middle phalange, or middle phalange 5, as long as it's there. You just don't want to say middle phalange. You want to indicate which one it is. It's the 5th. If I pointed here and I go, what is number 2? Then you would say 2nd, distal phalange. If I pointed to number 3, you would say 3rd, proximal phalange. If we pointed to number 4, you would say 1st, proximal phalange or phalanx. They're interchangeable. Okay. All right. Does anyone have any questions on that? Pretty straightforward, not as overwhelming as last week. The way that I would approach the studying for this would be pick a bone for the day, right? So you have clavicle and scapula. I knocked that out in one day to study it. Then I would do the humerus. Then I would do the radius and ulnar on day 4. And then I would do the hand on the 5th day. Just pick one section for each day for the week, and then use the other 2 to, Saturday and Sunday. The next, what's today? Today is Tuesday. So you have Wednesday, Thursday, Friday, Saturday, Sunday. One bone a day. And then Monday, you could use it to kind of refresh whatever it is you had some challenges with. But you want to get that done before Tuesday of next week. We do the lower extremity. And it should flow pretty much similar to the way today's class went. Of all the bones for next week, it's just the pelvis that seems to be a little bit more challenging, not impossible. It's not like the skull, but it's not a linear bone. And that's what makes it a little funky to learn, but that's all. Other than that, you should be pretty good. Any questions? Any general questions before we get going? Feel a little bit better this week? Yeah, you should. Use this week, since it's not overwhelming, to really catch up, nail this week, and then use it to go over the skull and stuff from last week. Hopefully you're up to speed with that, or at least 80 to 90% up to speed with it. Okay. All right, everyone. If I could go on, if you want to get a jump for next week, I can go on. If you want to stop, then we can stop here. It's kind of up to you. I'm okay with either. If you want to hold off here and use it and just study the upper extremity, I'm fine. If you want to get a jump and do some pelvis stuff, I can do that as well. I think you guys want to stop here. I can read your faces. Like, please, no more. I'm feeling pretty good about it. That's what consensus. I'm seeing some thumbs up here. All right. All right, everyone. Enjoy the rest of the day. If you have any questions, you know how to reach me. Stay on top of it. Next week is our last lab. We'll do the lower extremity. Use the announcement message to kind of be an overview to about how many questions on the different bones. And it's a good overview. It's not 100% exact, but it's pretty right on. It's a good lead. Okay. All right, everyone. We'll see you all next week. These videos should be uploaded in the next few hours. Once they're on the iCloud, I'll put them on the YouTube channel and we'll send them out as announcement message as I've been doing since the beginning of class. Okay.
Bye, Professor.
Thank you. Have a
Have
good
a
day.
good one, everyone.
Bye, Professor.
Be well. Good seeing you all.
Bye.